Hello everyone. Today we will have a Gyneac lecture about displacement of genital organs, and in displacement of genital organ we will have two topics important, three topics actually: uh, prolapse, retroversion and inversion. So one by one we will see the displacement of organs, and for that first one is prolapse, genital prolapse. Genital prolapse is commonly for Gyneac, we call it as uterine prolapse. So we will go in detail for uterine prolapse. Uterine prolapse, it is a prolapse or herniation of uterus from genital tract or from vagina, is called as uterine prolapse. Definition is, it is coming out of uterus, or herniation of uterus from vagina is called as uterine prolapse. Now uterine prolapse means, as you understand, it is coming out of uterus or herniation of uterus from vagina. So we have two types of uterine prolapse: congenital and acquired. We called it as causes also, congenital and acquired. Congenital prolapse is usually present from birth. It is seen in that child or in girl from birth. It is a developmental problem actually. So in these girls or in these females, prolapse is already seen from birth. So there is displacement of uterus, or it is a developmental defect. So the organ or the part of uterus is out of genital tract. This is congenital, but it is a rare condition. And acquired, which is very common. So we are going to see acquired uterine prolapse. Okay. So acquired prolapse, it is the uterine prolapse which develops usually because of age, parity and some other factors. So acquired uterine prolapse causes are important causes, as we know. Uterus is supported by ligaments, round ligament and broad ligament, and some uterine muscles, pelvic floor muscles. These are the supports of uterus which hold the uterus in the normal situation. So whenever there is any defect in this ligaments or in this muscle, uterus is loosened by this lack of support and it is displaced to downward direction, and that leads to uterine displacement or uterine prolapse. So in short, whenever there is lack of muscle tone in these ligaments or in pelvic floor muscle, there is uterine displacement. So this lack of support is mainly because of, first is age factor. As age increases, especially after 55 to 60, the muscle tone is usually decreased. As we can see now, in old age females, there is lack of muscle tone. So because of age, there is lack of muscle tone in the pelvic floor muscles. So that can lead to displacement of uterus. So first factor is age. Second factor is parity. Parity means how many times she has been delivered. That is called as parity. Multiparity, that means multiple pregnancies or multiple deliveries. So history of multiparity is important for prolapse, because parity or repeated deliveries, what it will cause, these repeated deliveries will decreases the muscle tone of that female. See, the pregnancies induces the pressure on the uterine muscles. Delivery induces the pressure on the uterine muscle as well as on the pelvic floor muscles. So frequency of these deliveries or repeated deliveries or short duration in between this pregnancy, all these factors lead to weaken the pelvic floor muscles. So whenever there is weakening of pelvic floor muscles, that will lead to uterine prolapse. So second factor is parity. Next is, as we discussed in previous point, repeated pregnancies, repeated deliveries, short interval between pregnancies and deliveries. These factors lead to prolapse. Next will be the birth injury. During delivery, sometimes if these deliveries are done by the untrained person, that can lead to some injuries during delivery. There are the pudendal nerves or the pelvic nerves, which are also contribute the important thing for the uterine support. So whenever there is nerve injury during this delivery and other procedures, that can lead to uterine prolapse. So birth injuries or nerve injury during delivery. Next is because of patient with history of chronic cough, constipation, like patient with asthma, bronchitis, tuberculosis, history of constipation, all these things are giving excessive pressure on abdominal muscles as well as the pelvic floor muscles. So that leads to displacement of uterus. Next will be the congenitally abnormal or congenital weakening of the muscles. There sometimes there are some diseases like poliomyelitis, you have heard, it is very common disease, or other diseases are there in which there is congenital weakness of this pelvic floor muscles and the nerve weakness. So that leads to uterine displacement. Next is condition like ascites, large ovarian cyst, tumor in abdomen. All this also gives pressure on the uterine muscle and leads to displacement. Next is delivery by untrained person at home, especially home deliveries. That leads to repeated home deliveries. That leads to uterine prolapse. Next will be main factor or main thing which lead to uterine prolapse is because of increased age, parity, improper delivery, short duration between pregnancies and deliveries, and the things which are giving excessive pressure on abdomen and pelvic floor muscles like ascites, large tumors, or multiple cysts or large cyst in abdomen. These are the main things which can cause the displacement. Other, as we discussed, nerve injury or weakness of pelvic floor muscles and nerves, this also causes the displacement of uterus. So these are some important causes for prolapse. Now also these are the causes of prolapse. Now we have to see for types of prolapse. Uterine prolapse types are, there are two types. You should know the anatomy of uterus. It is uterus is anteverted and anteflexed. This I had told you many times, but you should know the exact position of uterus. Uterus is anteverted and anteflexed. So on the anterior side of uterus there is bladder and urethra. On posterior side of uterus there is the intestine, rectum and other things. So you should know the exact location of uterus. So whenever there is prolapse of uterus, it is either from anterior side or from posterior side. Uterus prolapse or displaced from anteriorly or posteriorly. So depending on the prolapse site of uterus, types of uterine prolapse are of two, anterior uterine prolapse and posterior uterine prolapse. So anterior prolapse, it is again divided in two types. Whenever it is involving the anterior upper two-third part, it is called as cystocele. Cystocele means uterine prolapse with prolapse of bladder. Okay. Whenever there is anterior prolapse with lower one-third portion, that is called as urethrocele. That means prolapse of uterus with urethra. Now, whenever there is posterior wall prolapse, it is with upper one-third, that is called as enterocele. That means prolapse with coils of intestine. Uterine prolapse with coils of intestine. Whenever it is lower two-third prolapse, it is called as rectocele. That means uterine prolapse with rectum. Okay. So these are the types of uterine prolapse. Just to revise, anterior prolapse and posterior wall prolapse. Anterior prolapse, upper two-third prolapse with bladder, that is called as cystocele. Lower one-third prolapse with urethra is called as urethrocele. Posterior wall prolapse, whenever upper one-third prolapse, it is enterocele, that is coils of intestine with uterus. And whenever there is a lower two-third prolapse, it is rectocele, that is coils of prolapse of uterus with rectum. Okay. These are the types of prolapse. Now grades of prolapse. Uterine prolapse with grading. 0 grade is displacement of uterine fundus and it is just displaced from its normal situation or normal location. Grade 1, it is the uterine cervix reaches up to the vaginal introitus or vaginal opening. Grade 2 is uterine cervix is up to the vaginal introitus or up to the vaginal opening, or it is just reaches the vaginal opening. Grade third is cervix is out of vagina, or fundus of uterus also reaches up to the vagina. And grade fourth is procedentia, that means complete uterine body or complete uterus is out of vagina. Okay, these are the 4 grades. For your better understanding, slides are added for the grades of this prolapse. So 0 grade is displacement of the uterine fundus or cervix. Grade first, it reaches up to the vaginal opening. Grade second, it is out of vaginal opening. Grade third, body of uterus along with cervix is out of vagina. And grade fourth is complete uterus is out of vagina. So these are 4 grades. Grade fourth or complete prolapse is called as procedentia. Again, prolapse is of 2 types, incomplete and complete. Incomplete means partial prolapse of uterus, and complete means complete uterine fundus is out of vagina. So this is uterine prolapse. So just we will revise the uterine prolapse or displacement of uterus. Uterine prolapse means herniation of uterus from vagina. That means uterus or body of uterus comes out of vagina. It is of grossly it is of 2 types, congenital and acquired. Congenital is present from birth. Acquired is it is a developmental defect. It is seen usually by the increasing age. And causes of acquired prolapse, first and important is age factor, then parity, birth injuries, repeated deliveries, repeated pregnancies, heavy work, vigorous exercise, conditions like ascites, tumor, chronic cough, constipation, and poliomyelitis like conditions. So these are the main causes for prolapse. There are the types of prolapse, anterior and posterior. Anterior, it is again upper to, whenever it is anterior, upper 2/3 portion with bladder is cystocele, lower 1/3 is urethrocoele. Posterior, upper 1/3 is enterocele, coils of intestine with uterus, and lower 2/3 is rectocele, that is rectum is prolapsed with uterus. These are the types. Grade, there are 4 grades. 0 is just displacement started, first is up to the opening, second is out of opening, third is more part is prolapsed, and fourth is complete prolapse of uterus, that is procedentia. So up to this I guess you are clear. Now clinical features of prolapse. Clinical features are again they are divided, or they are clinical features or complaints will be depend on the grades of prolapse. Whenever there is just displacement, patient does not have that much feeling, but whenever the grades or grading of prolapse is increased, patient have that complaints. So clinical features actually depends on the grading of prolapse. So basic clinical feature or important clinical feature is something coming out sensation or bearing down sensation is very well marked. This is a patient complaint, there is coming out sensation or very discomfort in lower abdomen. There is bearing down sensation especially while coughing, while urination, while passing stool, while doing some exercise work. She have that bearing down sensation. That is very important. Something coming out sensation. That is the first sensation that female will complain. Secondly, she will complain of maybe dysuria, that is painful urination, frequency to pass stool, frequency of urination, then lower abdominal pain as uterus is displaced from the site. Patient have the discomfort and lower abdominal pain. Patient may have backache if it is posterior prolapse. The posterior side is affected, so backache. Patient, because of this displacement, some patient may have white discharge, some patient may have per vaginal irregular bleeding. So these are the main complaints. Important is bearing down sensation, something coming out sensation, especially while urination, passing stool, exercise, walking, or doing any motion. So something coming out or bearing down sensation is well marked. Secondly, a backache, urinary problems, dysuria, frequent urination, frequency to pass stool, lower abdominal pain, discomfort, white discharge or spotting or PV, bleeding, irregular bleeding. These are the complaints during prolapse. Now, if patient have infection during this prolapse because of if the part is out of vagina, there may be chances of infection. So whenever there is infection to genital organ, patient may have fever, chills and other findings of infection. Now signs on examination, basically general signs are usually normal because there is no excessive bleeding, so anemia, shock, it is not present. Generally patient is normal. Per abdomen also there is nothing to be palpated or there is no severe tenderness. Per abdomen is also usually normal. PSPV examination is the important investigation as well as it is the important thing which can show that there is uterine prolapse. So on PSPV examination only we can understand uterus is out of vagina or it is displaced. So depending on grade we can see the either the cervix is at vaginal opening or cervix is out of vagina or uterus is out of vagina or complete uterine body is out of vagina. Depending on grading of prolapse, we can see the findings on PSPV examination. This is the conclusion or this is the investigation part of uterine prolapse. You don't have to do any investigation for this condition because it is very easy to diagnose. So PSPV examination is very important. We can see the uterus or parts of uterus out of vagina. So that is about PSPV examination. And after that we have to do some investigation to confirm the things, like we can do the routine investigation, if necessary USG, especially ultrasound, transvaginal USG is advised for this to see the exact grading of prolapse and what nerves and other things are involved in this prolapse. So USG is advised, but as I said, for prolapse PSPV examination is the investigation. But for the other purpose we do the investigations. Now after that investigation, it is very clear, the condition is very clear, displacement of organ is seen and we have to treat the patient accordingly. So depending on the grading of prolapse, if the prolapse is at initial grade, just the displacement has been started or just the cervix is out of vagina, we can use first line of treatment, that is use of pessary. It is a metallic device or nowadays it is a plastic device which is inserted in vagina and it is kept in the genital organs or the vaginal cavity for depending on the grade of prolapse. It is kept in the uterus or it is kept in the genital tract for 1 to 3 months and observations are taken per month. PSPV examination is done and to check the position of uterus. So basic use of pessary. This pessary and all also I had added in the slides. The pessary usually maintains the normal position of uterus. If it is initial grading of prolapse, the position of uterus can be treated with the pessary. So use of pessary depending on grade 1 to 3 months or up to 6 months it can be advised. So this is basic treatment. Second treatment is depending on age of patient. If patient is at 40 or like not at menopausal age, or we have to conserve the uterus, we don't have to do hysterectomy, because hysterectomy or removal of uterus, it is a surgical procedure where we remove the uterus completely with uterus, fallopian tubes, ovaries and all the ligaments. That is complete hysterectomy we do. But because of this hysterectomy, many side effects are there. The hormonal level is disturbed, the other things may started. We are all going to see in hormonal replacement and other topics. So usually hysterectomy is avoided. So if we need to avoid this hysterectomy, there is another surgery, it is called as colporrhaphy. That is, in this surgery the ligaments of uterus are sutured or tightened so that they can hold the uterus tightly. That is colporrhaphy. And if not, grade is 4th grade or complete uterus is displaced and the age of patient is more than 60 and other things are in favor of hysterectomy, we directly go for hysterectomy. We remove the uterus entirely. So treatment is basically depending on grade. For initially we use pessary, and by doing repeated observations we advise for pessary duration, and if treated with pessary it can be continued. If not, depending on age and other things, we decide for surgical treatment, either colporrhaphy or hysterectomy. This is the line of treatment for uterine prolapse. Now complications of uterine prolapse, important is decubitus ulcers, that is friction ulcers. Whenever the part is prolapsed, or especially seen in procedentia, when the complete genital prolapse is there, the organs are completely prolapsed. So because of friction, whenever that lady have the movement that causes the friction in between thighs and the genital organ prolapse part, and that causes decubitus ulcer or friction ulcers. These ulcers are seen on the prolapse part, and because of this ulcer there are discharges, there are infection, and because of this infection patient may have septicemia like condition. So decubitus ulcer is a common thing. Other complications are urinary complication, rectal complication, dysuria, frequency of urination, incontinence of urination, constipation. So these are the other complications with prolapse. All this I had added with slides also, and as we had discussed, treatment of prolapse is, again, it is a surgical treatment, that is pessary, colporrhaphy and hysterectomy. We can treat the prolapse condition with well-marked homeopathic remedies. So this is again a homeopathic condition. So that cause uterine prolapse. It is displacement of uterus from genital tract or herniation of uterus from genital tract, and it is congenital, acquired, congenital present from birth, acquired because of many factors, mainly parity, age, deliveries and injuries, and some defects of nerves and muscles. Types are anterior and posterior. Anterior, again, two types: cystocele, urethrocoele; posterior, enterocele and rectocele. Grading 0 just started, first up to the opening, second cervix out of vagina, third cervix and uterus out of vagina, and fourth is complete uterus is out of vagina, that is procedentia. And clinical features is herniation sensation, bearing down sensation with urinary complaints, constipation or diarrhea, backache, lower abdominal discomfort. These are the main symptoms. On examination, directly we can see the PSP examination. Depending on grade, we can see the genital organ prolapse. Investigation not well marked, but for other purpose we do all the investigations. Treatment is initially pessary treatment, then colporrhaphy, if not hysterectomy. So this is all about uterine prolapse.